Well, it's actually a very busy mid-year conference season. We've got ASCO, EHA, and then also ICML in Lugano, which is always a highlight in the field of lymphoma. And there appear to be some really exciting abstracts coming out. Obviously, with my own particular interests, I'm very interested in the more bispecific data for some of the more advanced bispecifics. Glofitamab, we have new data coming out in mantle cell lymphoma. We have longer follow-up from our pivotal study, and we're also looking at some combinations with some very novel additional bispecific antibodies that are designed to give a second signal to the T cells that leads to, we hope, a higher level of activity and efficacy. So I look forward to seeing that data presented. I'm presenting some of that data, and my colleagues and co-authors are presenting some of that data across these different conferences. And of course, there's more epcoritamab data coming out, which I think is very interesting for the field. So I look forward to seeing that. That's a personal field of interest for me. Perhaps one of the most exciting pieces of data that we know is coming from press releases and from abstract titles is the data around ZUMA-7. So ZUMA-7 changed practice for diffuse large B-cell lymphoma in patients with first high-risk relapse because it showed significant progression, event-free survival advantage of CAR T cells over combination chemotherapy and autologous stem cell transplantation over that as an intended treatment. And we've seen a press release that shows that there is now an overall survival advantage. Now, I'm a co-author of that particular data, so I've seen the data. I'm excited to see how people respond to that because overall survival is so rarely shown now, and we have more effective treatments for diffuse large B-cell lymphoma, but for CAR T cells to now not only show this event-free survival, but also an overall survival advantage is really in my view, biased though it is as a co-author, a really important milestone for the treatment of relapsed diffuse large B-cell lymphoma and a milestone for the use of T-cell redirecting treatments in lymphoma as well, really putting to bed the question, in my view, about how active these treatments are and how promising they are when put up against chemotherapy. So that's extremely exciting. In Hodgkin lymphoma, there is also some exciting data coming out that really shows, well, it purports to show, I haven't seen the data yet, that the use of PD-1 inhibition prior to chemotherapy may be extremely effective. And we have seen over the last couple of years in patients with relapsed and refractory disease that if you give a checkpoint inhibitor prior to chemotherapy, be it standard doses of chemotherapy and particularly autologous stem cell transplantation, that complete remission rates after that package of treatment are extraordinarily high and extraordinarily durable so far in patients with high-risk disease. And now we have abstracts suggesting that approach of giving a checkpoint inhibitor followed by chemotherapy may be one of the most effective things that we've seen in the frontline treatment of Hodgkin lymphoma up against AVD. And so that particular data is something that I'm really looking forward to seeing. It's listed as a plenary at ASCO, and I'll be up in the middle of the night looking at that. So I think they're probably my highlights so far, but it's actually a very busy schedule for lymphoma, and I think there'll be lots of things that I discover as I dig into the abstracts a little bit deeper. I've got a bit of catching up to do.